Let me introduce myself. My name is Jean-Philippe Bogardi, and I'm joining you from the European headquarters of Roche Diagnostics in Rotkreuz, central Switzerland. It's a special honor to be here for me today, and I would like to thank the organizers for this. My name might not immediately reveal my Central European origins, but indeed this very university is where my maternal grandfather launched his academic career, did his first degree and also his PhD in mathematics, to then go on and become an expert in his chosen field of geometry further on. Unfortunately, I didn't live to meet him, but nonetheless, it's a special moment for me personally. Coming from the past and moving to the future, I'm actually here today, and there is maybe a link here to that history, is to talk about clinical decision support in oncology, or more specifically about how data that is generated at the bench side, but also at the bedside, can be converted into insight. And ultimately, how the digitalization that is now moving into healthcare will also change laboratory diagnostics and the way we work with healthcare information. So in this, I would like to also link to my previous speakers here, one of them highlighting that data is the new oil, but also the very insightful presentation earlier on looking at how radiology and clinical chemistry, how radiology in the laboratory are coming together to share insights and develop new strategies. So let's begin with that. Let's look at data, and we are experiencing currently a veritable explosion in the amount of data that is being generated and also stored. This amount of information is, of course, coming from existing technologies, but also new technologies that are also finding their way now into clinical practice. All of these different sources, well, first of all, it's a huge amount of data, but they're also beginning to contribute now to an increasingly detailed mosaic of insights on a specific patient. At the same time, though, the question is, how does this vast amount of information become useful? And if we look at information in healthcare, it's not just actually the amount, but also the pace at which this information is now coming. And one assessment has looked at the rapidly decreasing half-time of medical knowledge, saying that by next year, basically every 2 months or so, we'll be seeing a doubling of medical insight. So how do healthcare providers, both in the lab and in the clinic, actually manage to access the most recent and latest knowledge and make it available and include it in their decision making? This is compacted also by the level of complexity that this amount of data is representing, and this is particularly evident in the area of oncology, and several of the previous speakers have actually picked up on this in one way or another. We're facing here a disease that is in itself highly complex and, to make matters worse, also evolving and mutating. We are countering this complexity with an increase in our ability and in the number of technologies at our disposal to design diagnostic strategies to get at increasing levels of detail of what we're dealing with. And while that is, of course, great, it does increase and add another layer of complexity in this. And similarly, the progress we're now seeing in therapy options and also in the combinations thereof is, on the one hand, increasing the arsenal of options that are available to us to treat, but also the different questions and aspects that needs to be weighed in making those therapy decisions. And this weighing of options and therapy decisions, and this is where the previous talk was also very insightful, does also require different expertise and different disciplines coming together, also in a rather complex workflow along the patient pathway. And it's this particular this particular complexity here also at this level of the workflow that we have chosen to look at as one of our entry levels into the area of clinical decision making. All of this information coming together should in the end translate into this high resolution view of the patients, going from mosaic into something more comprehensive. And why is this comprehensive view really relevant, and why do we choose to focus on it? And this is because this comprehensiveness is what we believe will take us to that promise that individualized patient care has. The evolution, and this is really more talking about our colleagues in the pharma area, from the age of blockbuster drugs, which were great but also failed to work for some of the patients, to the current day of companion diagnostics, which already is a great improvement in itself, but is helping to direct therapies to cohorts and specific groups of patients, to adding that final element, and this is where we see clinical decision support as essential to be able to drive that individualized treatment of patients. We believe it does so by filling two gaps in the treatment pathway, which is the decisions of the treatment, but also later in monitoring, and both in terms of choosing diagnostic strategies as well as therapy. So before going into that, just one step back is also to understand what we mean by clinical decision support. I've talked a lot, and so have others, about the importance of data, and we've seen that there is vast amounts of it available. However, we also need to realize that data in itself is not the end game. There's the next layer up, which is to really apply complex analytics to that data. But it only becomes clinical decision support when you start putting it into the clinical context, and this might be called precision medicine or personalized healthcare. So it's truly a pyramid. So even though we have millions and tons of data, it only really becomes useful once it has been assessed and treated and put into that format that is required. So to do that, we have started actually looking at the workflow level, and when we look at complex decision making in oncology and bringing together different expertise areas, making sure that not only the expertise is there, but also actually the appropriate data in order to then be able to make treatment decisions. This is an area we started to focus on because this is where disease complexity, but also the complexity in decision-making come together, and where we feel the biggest value of decision support will come to play. But the starting point was to look at how we can really manage this clinical workflow using digital tools, and we started off with a platform that we've called the Navify Tumor Board. And we were able to show in a first instance that what this tool does, and this is not yet clinical decision support, but it actually adds a huge degree of efficiency when it comes to preparing the information and the discussion in these meetings. And this applied to radiologists, oncologists, and other participating experts in tumor board meetings. What this platform does, of course, is structure the process. By structuring the process, it also helps in structuring the data that goes into it. And as a next step in this ecosystem, we're now in the process of adding in the first tools and applications that will start contributing to clinical decision support. The two currently already in practice are our clinical trial matching and publication search. Neither of these yet amount to a super sophisticated decision support, but they're already contributing to the practical work that oncologists and other clinicians need to do. And this is, again, already an example where we match characteristics, whether they're laboratory-based or clinical characteristics, into identifying this information and bringing it into the hands of decision makers. We're in the process of now moving this on to looking at various treatment guidelines. So these have been the starting points. All of this is actually put onto a cloud-based ecosystem, which includes a platform as the backbone that provides an infrastructure where also this data is aggregated. We have the Navify Tumor Board as a workflow product, as a first example of that, but other applications are foreseeable also into other clinical areas. And then as we build further, we're looking to expand clinical decision support in this also, and this is also another hallmark of the digitalization, is to also create an ecosystem that is not limited to a single provider, but is actually open for either applications that are developed by institutions themselves or by other providers. Much as also some of the apps that we're currently already providing are coming from third-party collaborations. And then there is another element, and this is where clinical decision support also links in with what is happening at the bench side, which is that the digitalization is also holding its entry into the laboratory, whether it is smart algorithms that help with tissue sample analysis, or also algorithms that match mutational data and sequencing data with mutational information and gives treatment options based on known literature. So all of these elements are then feeding into our outlook into clinical decision support, looking at also longitudinal data over time, analytics, and other tools, and ultimately, and I think that was highlighted in one of the presentations as well, in terms of how we can also engage patients in their therapy decisions. I've already highlighted, and I would like to do so here as well, that of course, as Roche, we have a very strong tradition in both pharma and diagnostics that we're bringing into this, but none of this is possible as sort of a single provider alone. There is a combination that we're building here, both also with a strategic alliance with GE Healthcare to bring in the imaging aspect of things, and also with other providers such as Foundation Medicine or Flatiron that are looking at, for example, structured oncology data. So it is these three elements coming together, with the digital aspect being also new to us as a traditional provider. Sorry, one thing. Now, I would like to zoom out of this for a moment and also explore another element of clinical decision support that is very relevant. What does digitalization and clinical decision support actually enable? Are two virtuous circles where the decisions that are supported and driven by clinical decision support generate additional data and insights that can feed into new hypotheses and experiments being created. We just heard a talk about biomarker discovery, and we're already seeing initial efforts to look at so-called digital biomarkers. So new insights being generated that then feed into this. But the other perspective, and that's probably an even more exciting one, is how clinical decision support can help us make much clearer what the value is that is being generated, and to enable new models in healthcare development that are evidence or value-based, as it were. Because only now do we have the technical capabilities to capture what decisions were made and what their impact was, to engage with payers in a new dialogue about how healthcare should be funded. So these are exciting developments that we're only at the beginning of, and what I would like to close with is another reflection on this whole development, because oftentimes the digitalization of our everyday lives and also of healthcare is seen with some concerns and some risks. I actually believe it is something where we're coming full circle again. When we look back just for a few generations to the day and age of the family doctor, we had one person that in a way combined the information on you, on your family history, and on your surroundings, and was able to pull all of that information into their decision making. We've been fortunate to add a lot of new technology and insights into that equation, but it's only with digitalization that we can start bringing all of that together into a comparable scenario to say, yes, it is now available again back to the treating physician. So this is, in our view, and also in our conviction, by far not about replacing the decisions and the insights that clinicians bring to the table, but it is actually about enhancing it and also offering an opportunity to involve patients in some of these critical decision makings. So I hope that with this expose, I was able to add here to the considerations of this meeting and to trigger some thoughts and reflections also on how we're evolving in laboratory medicine. Many thanks, and open to some questions.